Okay, thank you very much.
Thank
Uh,
you.
Good afternoon, everyone. Welcome to the last of your lectures for today, and I'm going to be going through bacteriology and susceptibility testing. Just to get started, and I know you already know bacteriology is just a massive area of study, and I'm not going to be able to review everything, although you're going to think I do a lot of stuff. But this lecture is going to review the most important organisms, the laboratory tests, and then we're going to go through the relevant antimicrobial therapy and susceptibility testing in the end. Just like with the mycology and mycobacteriology, there's been many taxonomic updates over the last years, and the way they will be represented is the new name, such as Cocuria, will be first. The old name will be in parentheses, and then the species name. So let's get started. First off, we've got to be safe when we're working in the bacteriology laboratory. We need to perform risk assessment to make sure that we're performing all activities in the safest possible working environment. Bacteriologies are considered a biosafety level 2. In a BSL 2 laboratory, it's handling moderate risk agents that can cause human disease of varying severity by ingestion or through percutaneous or mucous membrane exposure. So those are the kind of things that you try to avoid. So you're going to do anything that would produce an aerosolization in a biosafety cabinet, and you're going to wear gloves and impermeable lab coats when working with patient specimens. Also, you need a waste management program to get rid of all of your biohazards. Let's begin with definitions. I think you know that an aerobe requires a high level of oxygen. A microaerophilic organism grows best with reduced oxygen and elevated CO2. Capnophilic requires a lot of very high CO2 to grow. An obligate anaerobe requires the absence of oxygen, and if they're exposed to more than 30 minutes of oxygen, they may die. There's also aerotolerant anaerobes. These are anaerobes, you would basically call them an anaerobe, but it's not really killed by that prolonged exposure to oxygen. And they grow best anaerobically, though. An example of an aerotolerant anaerobe would be Clostridium tertium. There's facultative anaerobes. These are organisms that grow well both in aerobic and anaerobic conditions. And these are most of the organisms that you think about, your E. coli's and staph and streps. If I say something is in lag phase, that means it's old. It's greater than 24 hours on agar plates. Old organisms are not good for biochemical or susceptibility testing. How about stationary phase? These are organisms that are alive, but they're not replicating. Stationary phase is ideal for transportation of patient specimens. How do we collect specimens for aerobic and facultative anaerobic culture? Well, let's talk about throat, wound, and abscess specimens. We're going to use a swab to collect. Old way would be polyester fiber, but the new way and better way is using a flocked swab, which is like a prickly sponge. You collect with the swab and put it into either Stewart's or Amy's transport media. That is a buffer solution with peptones and provide a beautiful environment for viability of the organisms, but it does not promote growth. It provides stasis of numbers prior to plating onto solid agar. The stability of most of these transport devices is around 72 hours. You should not use cotton fiber swabs. They can trap bacteria in the fibers and they're potentially toxic. Urine. There's two commonly used methods to transport urine in the lab. One would be boric acid preservative, such as used in that container on the right-hand side. The organisms will stay in stationary phase for transport. You can also refrigerate a urine at 4 degrees centigrade within 1 hour after collection. Both will maintain original colony counts and viability of the organisms for up to 24 hours. If you're dealing with tissues or sterile body fluids, you just need an adequate volume of fluid placed in a sterile container. How about blood culture collection and detection? Well, two things are very, very important for blood culture collection. You want to prevent contamination, so you need to cleanse the collection site using chlorhexidine. The national benchmark for blood culture contamination rate should be less than 3%, but every lab wants to make it much, much lower than 3%. The adequate volume of blood inoculated into blood culture bottles is very, very important. Adult blood culture bottles, as shown in the picture, should approach 8 to 10 mils of blood per bottle. A blood culture set, of course, consists of 2 bottles, a so-called aerobic environment bottle and one anaerobic environment. It is optimal to collect 2 sets per 24 hours. Each set is from a different site. Most laboratories use automated blood culture instruments to detect growth. It has become the standard of practice. Bottles will be incubated in these instruments at 35 degrees centigrade for